Like so many wound care practitioners, you will have seen sloughy and static wounds which are in need of debridement. This may take several weeks with the use of modern wound dressings, or you may have the facility to refer your patients for expensive specialist debridement.
How long would you expect autolytic debridement to take in a wound like this?
It could take between 2 to 5 weeks, maybe longer, depending on the amount of slough and debris that needs removing.
And what if you could achieve this in just 2 to 4 minutes, which is about the length of this film? What impact would that have for you and your patients?
It would mean less time, it would reduce the cost, and for patients it could accelerate healing, reduce dressings and improve the quality of life.
DebriSoft is a revolutionary new product for debridement, which is rapid, highly effective, safe, easy to use and very acceptable to the patient. Here you can see the impressive results from using DebriSoft. DebriSoft does not involve any expensive equipment, and you do not need any specialist training to use it. Linda Hayes runs a leg ulcer clinic and has been using DebriSoft. She has seen some impressive results.
How's that feeling?
Fine. Oh, that's gorgeous there. That's where it itches. Just there. Oh, it's wonderful, that.
DebriSoft consists of special polyester fibres which are soft and comfortable, so your patient need not worry about debridement of their wound. DebriSoft is very easy to use and comes in a practical 10 by 10 centimetre size, so you can use it on the ward, in your clinic or in a patient's home. DebriSoft must be moistened before use, and you may use any common wound cleansing solution, which may be normal saline or tap water. Always refer to your local guidelines. You may find it helpful to wash away any emollients from the skin before using DebriSoft. You only need a gentle amount of pressure when using DebriSoft on the wound area and surrounding skin. Debris and exudate are quickly removed and bound up within the DebriSoft. The DebriSoft fibres are very soft, and this helps protect new granulation tissue and epithelial cells, leaving healthy tissue intact. Debris in a wound impedes new cell growth and is a breeding ground for bacteria. This can result in delayed healing. The soft, flexible monofilament fibres of DebriSoft reach all uneven areas of the wound bed. The tops of the fibres are cut at a special angle so that they can actively remove debris and exudate, which are swept up and bound within the fibres. This whole process can take as little as just 2 to 4 minutes. DebriSoft is very gentle on patients. In a multi-centre real-life study, 97.4% of patients said they did not experience any pain or side effects after DebriSoft was used. DebriSoft is a single-use product, so once you have finished debriding with DebriSoft, it can simply be disposed of in normal clinical waste. DebriSoft can be used on a variety of wounds such as leg ulcers, pressure ulcers, diabetic foot ulcers, post-operative wounds healing by secondary intention, and also hyperkeratosis. For best results on hard necrosis and thick tenacious slough, it is beneficial to treat with autolytic debridement prior to treatment with DebriSoft.
Before you started using DebriSoft, what methods of debridement did you use previously?
I tend to use dressings such as a hydrogel or a hydrocolloid dressing, and in some instances I would use some sharp debridement as well.
And what problems, if any, did you experience with these methods of debridement?
It was generally the length of time that they actually took to work to debride the wounds, and in some instances they could be quite painful or cause some discomfort to the patients.
What impact has DebriSoft had on the care that you give to your patients?
It's been really good. I mean, DebriSoft debrides the wounds, really quickly, and the patients like it. They can see an improvement in the wound, and it's actually improved their quality of life. Also, it's reduced the amount of dressing changes that we've had to do.
And what hints or tips would you have for a clinician using DebriSoft for the first time?
Firstly, you need to make sure that the limb and the surrounding area is clear of any emollients. Keep the Debri-Soft moist while you're using it, and use a good circular motion actually on the wound itself. And remember that it may not work the first time, you may have to use it 2 or 3 times to get the best benefit from it.
Not only are the benefits of Debri-Soft immediately visible after use, but they can be seen in the improvement in your patient's wounds when you next see them.
I have a gentleman who attends one of my leg ulcer clinics. He has quite a sloughy venous leg ulcer, and I used Debri-Soft to aid debridement of his wound. Not only did I see sort of instant results using the Debri-Soft, but also this improvement of his wound continued through until this following dressing change the week later.
Now there is a new way to achieve rapid, effective, safe debridement, which is easy to use and also very acceptable to your patients. Join the debridement revolution today.